Hello, my name is Alexandra Monica Gindu. My student number is N41381735. Welcome to my presentation for my contemporary issues assignment. My subject today is contemporary issues within the area of the health and social care sector, specifically for elderly care within the COVID-19 pandemic. It can be noted that the contemporary issues in the area of health and social care were mainly related to the macro factors like the COVID-19 pandemic and Brexit, as well as the micro factor which occurs within the organization. It was analyzed that due to COVID-19, the funds allocated for care and treatments provided to the older care by the UK government were postponed. Moreover, as a skills shortage is a major issue in current dynamics, Brexit impacted the skilled care practitioners to face difficulties in coming to the UK and commencing care jobs. This poses an additional burden on existing care practitioners, and this led to impact on the physical and mental well-being of care workers. Influence of contemporary issues in service improvement. Since the COVID-19 pandemic incurred a detrimental impact on the care providing facilities of the UK healthcare sector, the sector specifically focused on improving the elderly care and treatment facets. Several care homes delivering care and treatment service to older patients were initiated to train employees and staff regarding ways to self-manage the work and help elderly patients with certain tasks. However, it was noted that during the peak of the pandemic, the sector of UK healthcare faced a significant issue of limited healthcare resources, for which the overall waiting list and time inclined monumentally. It was noted that as of October 2022, more than 7.2 million patients were waiting to avail the healthcare services, and out of the identified numbers, a major number of patients were aged and old. In order to tackle the problem of limited resources, the government shed light on improving the service provisions for lowering the waiting time for all patients, mainly for elderly patients in emergencies. This was done by strengthening the public and private care homes operating for elders with necessary amenities that could improve the overall service delivery and help the healthcare sector manage the number of elder patients who get optimal service within their capacity. It can be noted that to tackle the staff shortage in the prevailing terms of increasing demands of elderly care, the UK government shed light on making provisions for their staff hiring process. The UK government have given several visas to fill the skills gap amid the post-Brexit situation. In addition to this, as staff were hired, several care homes that focused on providing elderly care were able to efficiently distribute the workload and mitigate the pressure terms from the existing care providers and practitioners. Key perspective of the contemporary issues. In references to the information that has been given in the above section, it is to be said that the key perspective that is it to be considered is that COVID-19 has been able to make negative impact on elderly care. For example, it is to be said that many of the elderly citizens of the UK have been facing the problems of depression and anxiety among them. During the times of the COVID-19 pandemic, it was seen that the government of the UK had been giving significant importance to the care of the elderly. Apart from that, the COVID-19 pandemic can have a certain degree of influence on the caregivers as well. For example, many caregivers in the country have been facing the problem of burnout in them. The effect of the issue on the elderly care delivery. Based on the information that has been given in the above section, it is to be said that COVID-19 has been able to make a negative impact on elderly care delivery in the UK in an effective manner. One of the main reasons for this is that many of the elderly people were facing diagnosis as well as medication delay. This includes the elderly care as well. One of the important elements that is to be taken into account is that about 30% of the elderly people have been able to highlight the fact that they were not able to get proper support. In references to the information that has been given highlighted above, it is to be said that the care needs of many of elderly people are not being met properly. For example, it is seen that there has been a delay assessment that is preventing older people from getting the necessary care. On the other hand, it is to be said that there has been a problem related to the shortage of staff in the selected elderly care. For example, it is seen that the shortage of staff have been leading to about 855,000 being admitted to the hospital. Overall, is it to be said that the COVID-19 has been able to make a significant level of impact on elderly care delivery. Potential strategies to minimize the disruption of the elder care service during pandemic. It is important to develop effective strategies to minimize disruptions to the elder care service during pandemic. Strategic planning is needed to minimize disruptions, and the planning must focus on adaptability and disruptions. The healthcare organizations can maximize telehealth service. This can help the healthcare organization ensure continuous medical support. The telehealth service can minimize the need for in-person visit and risk exposure. However, training should be given to staff and elderly so that they can use digital tools effectively. An effective protocol for controlling infection is important, for example, the use of PPE and sanitation. The strategy can help safeguard both employees and patients in the healthcare organization. It is further important to maintain clear as well as consistent communication with stakeholders of the healthcare organization. Effective communication tools can be used to improve communication. Potential outcome of the strategies. The potential outcome of telehealth service can be significant in informing patients about key information and insights without any requirement to physically go to care institutions. Telehealth service also reduces commute issues for elderly ones and lowers the chance of being affected by contagious patients while visiting the hospital and care homes. The outcome of the infection control protocol can be helpful in preventing and stopping the transmission of infections with relevant and appropriate measures and guidelines of DOS and do's and don'ts. This may benefit the elderly patients to abide by the guidelines to prevent themselves from health-related issues. Additionally, continuously communicating to the patients become an imperative and effective tool to tackle many complicated situations. Effective communication via telephone, video, and other modes can help the patient to stay safe and protected, and inform the family members to safeguard the elderly from potential health-related issues by holding adequate protective steps. Conclusion. In the conclusion of the study, it is to be said that there are a range of elements that are to be taken into the account. For example, it can be seen that the events of the COVID-19 have been able to make a significant amount of impact in terms of elderly care. One of the core elements in that many of the elderly people are not able to get the necessary care. It is to state that there has been a significant amount of degradation in terms of the service delivery for elderly care. There are a certain numbers of strategies that are to be taken into account. For example, the use of telehealth services can be taken into account. Apart from that, it is to be said that the use of the infection control protocol as well as consistent communication is to be done. One of the main reasons for this is that it will be able to help in the reduction of the issue in an effective manner. It is to be said that significant level of attention is to be given to elderly care, as a significant number of elderly people are dependent on such service for their survival. This has been my presentation for contemporary issues within the area of health and social care sectors, specifically for elderly care. Thank you for watching. Have a lovely day.